Hello family, welcome to another beautiful edition of Annie Otter's vlog. If today's your first day watching me, you are in the right place at the right time. Please do not forget to follow me and subscribe to my channel. I'm Annie Otter's vlog on Facebook and on YouTube, okay? If you're a returning fan, well wisher, subscriber, follower, lover, I love you so much and appreciate you. Please do not forget to share this video. Alright, so in today's video, I'm going to be zooming in into mental health. Yes, mental health is real, okay? This is not a matter of our village people, my neighbor, somebody who hates me or whatever. But mental health is real and we need to stay healthy mentally. Alright, so I'm zooming in into this news that broke out about a week and a half ago. About a lady that was residing in Lekki, Lagos, Nigeria. So this lady by name Miss Afolake Abiola, 47-year-old, took her own life, okay? So the news broke out that this lady was so lonely, she wasn't married, didn't have any kid, that's why she did it. No. Upon investigation, according to Vanguard newspaper in Nigeria, one of the most trusted newspaper in Nigeria, interview from the family members and neighbors. So this lady had a mental issue. According to the family, she was suffering from depression. So depression is real. It's not a matter of somebody's just sad. Depression is real and it's a mental health disorder that needs to be taken care of immediately and adequately from the right source, okay? So zooming into mental health issues, I'm going to be looking at mental health briefly because we don't have the entire time to exhaust what we need to talk about, okay? But I'm just going to hint us the most important things that we need to know about mental health. In today's edition, I am going to be focusing on the most common mental health disorders out there, and these are in no particular order. We are focusing on 5 of them. So we have depression, we have anxiety disorder, we have bipolar, we have schizophrenia, and we have post-traumatic stress disorder, PTSD. So these are the ones that we're going to be briefly touching. So if you want to know more about this, you can inbox me, you can chat me up, or you can actually seek a mental health evaluation. Go to your psychiatric doctor and seek evaluation. It's very, very important. If you know that you fall into any of these categories or you've been having symptoms close to these categories, please seek help immediately. Mental health is real and we need to tackle it as a disorder, as a problem, as a disease, okay, to be able to take care of this issue the way we should, okay? First one is depression. What exactly is depression? Depression is a mental health disorder characterized by persistently dispirited or dejected or loss of interest in activities, causing significant and impairment in your daily life, okay? So depression, in other words, can be mild, temporary episode of sadness due to loss or trauma, or severe or even persistent, okay? So the person involved feels sadness, tearfulness, emptiness, worthlessness, hopelessness, anger, frustration, loss of interest, sleep disorder, weight loss or weight gain, agitation, or this person has this recurrent thoughts of taking away his or her own life. So this is depression. So the causes of depression can be psychological, it can be medical, it can be due to trauma, okay, that has happened to that individual involved. It can be poverty. To seek help, seek psychiatric evaluation and psychiatric treatment, okay? So there will be some type of medication, some type of group therapy, or some other ways of taking care of this depression. But the main thing is to seek help immediately you start feeling something different, or family members or friends and well-wishers can also initiate the this help accordingly, just in case that person involved cannot take care of himself or herself. So his or her dear ones should be able to take care of him or her. And the next one I want to talk about is anxiety disorder. So mental health disorder characterized by feeling of worry, anxiety, fear. Okay, so this feeling can interfere with your daily activities and can mess people up. Okay, so people that has this anxiety disorder, they feel nervous, they are restless, okay? They feel like there is impending doom. Something is going to happen, something bad is going to happen, and their heart rate is always on the run. Even you can see them sweating when they are not even feeling hot or the weather is not hot. And these people have uncontrolled worry. They are always thinking, they are tensed up, okay? And they are hyperventilated, they are breathing so fast, okay? These people sometimes they are trembling, they are shaking, they have problem concentrating, okay? So even some of them, it will cause them to have diarrhea or constipation, as the case might be. So when you see people passing through this, they need help, they need psychiatric help. And this situation can be caused by trauma, by illness, by stress, by drug abuse, alcohol abuse, personality disorder. So we need to be very, very careful to make sure that our loved ones, our friends, our neighbors, even our church members get the right help they desire. They need psychiatric evaluation. From there, they will get the best treatment ever. I know some people go to prayer houses. I'm not condemning it, but sometimes some of these things need to be evaluated and taken care of the right way, and we must follow it the right way. Yes, the other part might be supplementary. So let's do the right thing at the right time before the person enter market too. So the next one I want to talk about is bipolar. Bipolar is a mental health disorder associated with episodes of mood swings ranging from depression to lows to maniac high. So bipolar, you can see somebody behaving very well. All of a sudden, this person go crazy, uncontrollable. The person acts outrageously. Then all of a sudden, this person is okay. You'll be like, what is wrong with this person? So that's the high and low of bipolar. So sometimes it's episode, sometimes it doesn't happen. Sometimes it's just seasonal. I don't know, if something clicks and it happens. So in other words, you see this person have this high energy. Sometimes this person wants to act out because the energy is uncontainable. So again, this person cannot even sleep because this person is actually vibrating, want to act out all the time. So this person loses touch with reality. Okay, this type of person can jump up from off the roof and not even be afraid of anything because they are in that high cloud. Okay, so this kind of person, they don't really have interest in things that promote life and contributes to the community. So this episode of psychosis can be very dangerous if not well controlled. So some of them are very unusually talkative. They're just talking. You'll be like, what is wrong with these people? So in other words, they make poor decisions. They can hurt somebody, they can hurt themselves, they can do outrageous things, okay? So their safety is a priority to make sure this person are in good hands, in good environment. And again, they need psychiatric evaluation. They need to stay on medications according to what the psychiatric evaluates out of them. And also therapy as much as they can. Again, family members need to stick around to help out as much as possible to make sure this person consistently take their medication the way it was prescribed and stay in the therapy that have been prescribed to them. Okay, so the causes of this bipolar is still unknown, but it can be biological differences, that changes in the brain. Okay, again, it can be genetics. Yes, it can be genetics, can be alcohol and drug induced. So that's why we need to be careful what we take. We need to be careful. Stay away from street drugs. Stay away from alcohol. They can mess up your brain. The neurotransmitters in your brain can be zapped out and messed up through all these things you take here and there. So we need to stay away from street drug. Yes, if you go enter the street now in Nigeria, you see a lot of young people dirty, naked, doing all sorts of stuff because their brain has been messed up from drug and alcohol. Again, that's why we need to preach. Stay away from drugs, stay away from alcohol, and stay clean so that your mental health will be also intact. Okay, all right. So a sister or a relative of bipolar is schizophrenia. Yes, so this is another mental health disorder that affects a person's ability to think, feel, or behave clearly or behave normally. So in schizophrenia, the person is crazy too. This person is mentally unstable. It can be episodes, it can be seasonal, it can be just temporary thing. It comes and goes, and sometimes it stays, okay? So every individual is different. It affects people differently. We have no control about how schizophrenia is going to affect anybody. So in other words, this person that has schizophrenia has disorganized behavior. Okay, this person has aggression, agitation, compulsive behavior, anxiety, excitability, hostility, lack of restraint, delusional, amnesia, mental confusion, false belief of superiority. Yeah, they think they are up there, but in the real sense, nothing they happen. Anger, discontent, hallucination, and paranoia. So in other words, these people are not in their right state of mind. So if you can, in that maniac stage, please be careful approaching them, because they are in cloud nine and they can hurt anybody or hurt themselves. They are not in control of anybody. If they happen to hurt you, it's going to be a mental issue problem. So they won't be charged for much. So that's why we need to be careful. So when you see people behaving somehow, you need to be careful how to approach them. Not everybody is mentally healthy. No matter how you look at them, no matter how you respect them, no matter who you think they are. A lot of people out there are mentally unstable. You see people lashing out unnecessarily, talking unnecessarily, attacking people unnecessarily, getting angry unnecessarily. Something is wrong with some of them. So that's why we need to be very, very careful with people we deal with every day, in the offices, in the streets, in the church, in our community, in our spaces. Yes, when you see people behaving abnormally, yes, either you help them or you put yourself in a safe place. Yes, don't quarrel with anybody, don't fight with anybody, because you don't know what is playing for them, okay? What is playing in their brain. That's why you need to be careful. So all these people doing all these things here and there, talking, fighting, lashing out, this and that, you need to be careful how you approach them, because some of them are mentally derailed. They are mentally sick, okay? Not everybody is that you see out there is healthy. No matter, even if they dress good, they live in a nice house, they drive a nice car, some of them are mentally sick. It's just a click before they blow up. So that's why we need to be very, very careful how we deal with people. The cause of schizophrenia is still not unknown, but the risk factors can be genetic. It can be brain chemistry disorder. It can be environmental factors, okay? So that's why we need to be very, very careful. Again, seek treatment. Once you know that something is not right in your brain, seek help. Again, family members, spouses, loved ones, please make sure that your loved ones get the care they need, the mental health support they need. Then another one I want to talk about is the post-traumatic stress disorder, PTSD. So this one is a disorder in which a person has difficulty recovering after a difficult experience, a terrible experience, or somebody have witnessed something that is very, very terrifying, okay? So every now and then that person will have a flashback, and when that person has that flashback, it breaks that person down, or it can make that person crazy. It can make that person to experience difficulty concentrating, difficulty proceeding with life. It can put that person into depression, anxiety disorder, okay, because of what that person have been through. So people who have been through traumatic events, maybe during childhood or maybe during adulthood, anytime in life, it can also linger for the rest of their life. You can see children who live in an abusive house, you know, all this house help, okay, that was terribly abuse. Some of them, that abuse will give them that post-traumatic stress disorder throughout their lifetime, unless they have intervention along the way and they go through therapy. So that's why we need to be very, very careful how we treat people, how we approach people, what we do to people. Because sometimes you might not even know that what you have done to somebody has caused trauma in that person. You might not even know. You will take it like everyday thing. But in other words, you have caused a lot of trauma that is going to damage somebody's life if care is not taken. So that's why we need to be very, very careful what we do along the way in this world. If you cannot make somebody's life better, please don't destroy. Don't create trauma. Don't create incident that will linger and cause that person his or her lifetime or damage that person for life. Okay. In other words, people that have passed this that has this post-traumatic stress disorder has a whole lot of terrible nightmares, okay? Unwanted memories of terrors, okay? You see them, sometimes they start trembling and shaking. Immediately they see something close to what has happened to them. Or maybe something just happened, flashback. You know, their thought goes back to what has happened to them, and they go into this depression, anxiety, and all these disorders will come through. Again, these people have mood swings, okay? And it can be sudden, it can be gradual. So we need to be careful. When somebody's going through this, please help them to get the help they need. Again, this kind of people, the best way to avoid triggers. But in other words, sometimes we don't even know what's going to trigger. You can open your Facebook or Instagram or whatever. You see something that will remind you of what you've been through. Then this incident will occur. So these 5 mental health disorders that I have discussed briefly, because they are way too deep, but again, because of time, we have to touch bases, okay? So they are, again, depression, anxiety, bipolar, schizophrenia, and post-traumatic stress disorder. So again, there are so many other mental health situations out there, but again, these are the 5 that I wish to discuss. If you need more details, you can inbox me, you can chat me up, or you can actually go to your mental health provider, your psychiatric doctor, to have detailed discussion, evaluation, and care. And also therapy is very, very important. Going to churches, those are good, but again, make sure you balance things out, okay? When things are mentally, go to mental hospitals. These are not something that is coming from your village. These are not something that somebody is throwing arrow at you. Sometimes some of these things are psychological, some of them are medical, some of them are drug or alcohol induced, some of them are just situational induced, some of them are just genetics. Yes, it might linger from your parents, your family, your immediate family. So if you know something like this is in your family and you start having some symptoms, please seek help immediately. It's very, very important that you seek help before it gets worse, okay? We don't want anybody hurting anybody or hurting themselves due to mental health disorder. So that's why we create this awareness, so that people can take care of themselves immediately and as quickly as possible. When that person cannot take care of herself or himself, please, neighbors, friends, well-wishers, colleagues, church members, help them immediately, or call their family members to come to their rescue. Mental health is real. It is real as any other sicknesses out there. Thank you so much for watching another beautiful edition of Annie Otter's vlog. Please do not forget to share, like, and follow me on Facebook and on YouTube. I'm Annie Otter, and I love you, and will always do my videos. Love you guys. Bye guys.